Hello, everyone. Welcome back to Speak English Daily. I'm Emma. We're on day 27 of our 30-day English shadowing challenge. One topic every day to transform your English speaking skills. Wow, day 27. We're almost finished. Can you feel how much your confidence has grown since day one? Every single one of you who has been following this journey, you should be so proud of yourself. You've been building English speaking skills that millions of people dream of having. And for those wonderful students leaving comments about using English at work, with neighbors, at the store, you're living proof that this method works. Your success stories help thousands of learners around the world. And hey, if you're just joining us on day 27, perfect timing. Today, we're talking about something that makes everyone nervous. Going to the dentist. This is English you'll need in real life. No matter where you live, dental visits happen everywhere. Now, let me tell you a story that might sound very familiar. You're sitting in the dental office, waiting room. The receptionist calls your name, but you didn't hear it clearly. You go to the desk. She asks, "Any changes to your insurance?" Your mind goes blank. You want to say your tooth has been hurting for 3 weeks. You want to explain you're scared of dental work. You want to ask about the cost. Instead, you just nod, point to your mouth, and say, "Tooth hurt." The dentist asks, "When did the pain start? Is it sharp or dull? Does it hurt when you eat?" You understand maybe 30% and just say yes to everything. This scary experience stops today. Everyone needs dental care. Everyone feels nervous at the dentist. This is something that connects you with every English speaker. Ready? Let's make dental visits your English confidence win. We'll say each phrase 3 times. Normal speed, then slow and clear, then normal speed again. But here's what makes this lesson special. Don't just repeat, feel the emotions. When you practice, "I'm nervous," actually feel that nervousness. When you say, "Thank you, doctor," feel real gratitude. You're not just learning dental words. You're preparing yourself for real-life communication when you're stressed. Part 1, Making Appointments and Reception. Simple phrases for scheduling and arriving at the dentist. I need a dental appointment. I need a dental appointment. I need a dental appointment. I want to schedule a cleaning. I want to schedule a cleaning. I want to schedule a cleaning. What times do you have? What times do you have? What times do you have? I like morning appointments. I like morning appointments. I like morning appointments. Can I come next week? Can I come next week? Can I come next week? I'm here for my 2 o'clock appointment. I'm here for my 2 o'clock appointment. I'm here for my 2 o'clock appointment. I'm a new patient. I'm a new patient. I'm a new patient. Here's my insurance card. Here's my insurance card. Here's my insurance card. I need to update my information. I need to update my information. I need to update my information. How long is the wait? How long is the wait? How long is the wait? Can you call me if someone cancels? Can you call me if someone cancels? Can you call me if someone cancels? I need to change my appointment. I need to change my appointment. I need to change my appointment. Perfect. Now you're checked in and sitting in the dental chair. But something's wrong with your tooth. How do you tell the dentist exactly what you're feeling? Here's how. Part 2. Describing dental problems. Use these to clearly explain what's wrong. My tooth hurts. My tooth hurts. My tooth hurts. I have a toothache. I have a toothache. I have a toothache. The pain started 3 days ago. The pain started 3 days ago. The pain started 3 days ago. It hurts when I eat. It hurts when I eat. It hurts when I eat. It's a sharp pain. It's a sharp pain. It's a sharp pain. The pain won't stop. The pain won't stop. Stop. The pain won't stop. My gum is swollen. My gum is swollen. My gum is swollen. I think I have a cavity. I think I have a cavity. I think I have a cavity. My tooth is sensitive to cold. My tooth is sensitive to cold. My tooth is sensitive to cold. I lost a filling. I lost a filling. I lost a filling. My tooth feels loose. My tooth feels loose. My tooth feels loose. I broke my tooth. I broke my tooth. I broke my tooth. It hurts when I drink something hot. It hurts when I drink something hot. It hurts when I drink something hot. Excellent. The dentist understands your problem. Now they're going to look at and treat you. This is when you need to speak up for your comfort and safety. Part 3. During the dental examination. Perfect for talking with your dentist during treatment. Please be gentle. Please be gentle. Please be gentle. I'm very nervous. I'm very nervous. I'm very nervous. Can you explain what you're doing? Can you explain what you're doing? Can you explain what you're doing? Is this going to hurt? Is this going to hurt? Is this going to hurt? I need a minute to relax. I need a minute to relax. I need a minute to relax. Too much pressure. Too much pressure. Too much pressure. I feel pain right there. I feel pain right there. I feel pain right there. Can you give me more numbing medicine? Can you give me more numbing medicine? Can you give me more numbing medicine? I feel dizzy. I feel dizzy. I feel dizzy. Can I rinse my mouth? Can I rinse my mouth? Can I rinse my mouth? Is it almost done? Is it almost done? Is it almost done? How does it look? How does it look? How does it look? Great. Now the dentist has explained what's wrong. But before you say yes to any treatment, you need to understand your options and what they cost. Part 4, Treatment Options and Costs. Important for understanding your dental care options. What treatment do I need? What treatment do I need? What treatment do I need? How much will this cost? How much will this cost? How much will this cost? Does my insurance cover this? Does my insurance cover this? Does my insurance cover this? Can I pay in parts? Can I pay in parts? Can I pay in parts? What are my choices? What are my choices? What are my choices? Do I need this right away? Do I need this right away? Do I need this right away? How long will the treatment take? How long will the treatment take? How long will the treatment take? Will I need to come back? Will I need to come back? Will I need to come back? What happens if I don't treat this? What happens if I don't treat this? What happens if I don't treat this? Can you write down the cost? Can you write down the cost? Can you write down the cost? Is there a cheaper option? Is there a cheaper option? Is there a cheaper option? When do I need to decide? When do I need to decide? When do I need to decide? Beautiful! You've made your decision and finished your treatment. The final part of your dental story is taking care of yourself at home. Part 5, Follow-up Care and Instructions. Important for taking care of your teeth after treatment. How should I care for this? How should I care for this? How should I care for this? When can I eat normally? When can I eat normally? When can I eat normally? Should I avoid some foods? Should I avoid some foods? Should I avoid some foods? When should I come back? When should I come back? When should I come back? What if the pain doesn't stop? What if the pain doesn't stop? What if the pain doesn't stop? Can I brush my teeth tonight? Can I brush my teeth tonight? Can I brush my teeth tonight? Should I take pain medicine? Should I take pain medicine? Should I take pain medicine? Is some bleeding normal? Is some bleeding normal? Is some bleeding normal? When do I schedule my next cleaning? When do I schedule my next cleaning? When do I schedule my next cleaning? Thank you, doctor. Thank you, doctor. Thank you, doctor. I'll see you in 6 months. I'll see you in 6 months. I'll see you in 6 months. Amazing work. You've just learned 60 important dental phrases. Now, let's put them into action with real scenarios that you'll actually experience. We have 2 realistic dental scenarios for you today. Pro tip: these aren't just dialogues, they're your practice sessions for real life. Feel the nervousness of being at the dentist. Picture yourself in that dental chair. Smell the clean smell of the dental office. Hear the sounds of dental equipment. Feel your heart beating a little faster when the dentist comes near. Imagine the relief when the treatment is finished and you can speak clearly again. Scenario 1. First visit to a new dentist. I have Dr. Michael joining us to help with our dialogue practice. Dr. Michael will be our dentist for the first scenario. Follow along with both parts. Feel the nervousness, then the relief. Good morning. I'm here for my 10 o'clock appointment.
Good morning, Emma. Welcome to our office. I see you're a new patient.
Yes, I am. Here's my insurance card and the forms I filled out.
Perfect. I see you haven't been to a dentist in 2 years. Any problems with your teeth?
Well, my tooth hurts sometimes. It started about a week ago.
I see. Can you show me which tooth? Is it a sharp pain or a dull pain?
It's this one, on the right side. The pain is sharp when I eat.
Okay. And does it hurt when you drink something cold or hot?
Yes, especially cold drinks. It's very sensitive.
All right. Let's take a look. Please sit back and open your mouth wide.
Okay, doctor, I'm very nervous about dental work.
That's completely normal. I'll explain everything I'm doing, and please let me know if you need a break.
Thank you. Can you be gentle? I don't like pain.
Of course. I'm just going to look at your teeth first. This won't hurt at all.
Okay, what do you see? Is it bad?
You have a small cavity in your back tooth. It's not serious, but we should fill it soon.
A cavity? How much will the treatment cost?
With your insurance, it should be about $80. We can schedule it for next week.
Does my insurance cover the cleaning too?
Yes, cleanings are covered, 100%. Would you like me to clean your teeth today?
Yes, please. How long will it take?
About 30 minutes for the cleaning. The filling appointment will take about 45 minutes.
Okay, that sounds good. When can I schedule the filling?
How about next Tuesday at 2 p.m.? And I recommend coming back in 6 months for your next cleaning.
Perfect. Thank you for being so patient with me, doctor.
You're very welcome. Take care and see you next Tuesday.
Perfect. Notice how we covered nervousness, treatment options, costs, and scheduling, all the important parts of a dental visit. Scenario 2, treatment visit with complications. In this scenario, you're returning for a filling, but there's some complications. You need to communicate clearly about pain and ask questions about your treatment. Practice staying calm and asking for what you need. Ready? Here we go. Hello. How has your tooth been since last week? I'm sorry to hear that. Show me where it hurts. Let me take another look before we start. I'll use numbing medicine. You'll just feel pressure. I understand. I'll use numbing gel first. Of course. First, I'll numb the area. Give it 2 more minutes. How does it feel? Good. Now I'll remove the bad part. Let me add more numbing medicine. The cavity is bigger than I thought. You might need a crown, not just a filling. It's about $800, but insurance helps. Probably around $300 with your insurance. We can try, but it might not last long. Maybe 1 or 2 years. A cloud lasts 10 to 15 years. Good choice. I'll make a temporary one today. In 2 weeks for the permanent crown. You're welcome. Call if you have any questions. Excellent. You handled unexpected treatment changes, talked about costs, and made good decisions, just like a confident English speaker. Now, as we finish this life-changing lesson, I want you to realize something amazing. You know what you just did? You learned one of the most challenging situations in English, medical communication. But more than that, you now have the power to take care of your health with confidence. Dental health is connected to your overall health. And now you can communicate about it clearly in English. No more pointing at your mouth and hoping the dentist understands. No more saying yes to everything because you're afraid to ask questions. No more avoiding the dentist because communication feels impossible. Before you go, I want you to make yourself a promise. Promise me you'll use this vocabulary to take better care of your health. Practice these phrases in front of a mirror. Look at yourself and say, "My tooth hurts. It's a sharp pain when I eat." Feel the words in your mouth. Practice opening your mouth wide, like you're at the dentist. Point to different teeth and describe imaginary problems. This tooth is sensitive to cold. Mindset shift every time you practice dental vocabulary. You're not just learning English, you're preparing to take control of your health. You're building the confidence to ask important questions about your body. The English-speaking world needs people who can communicate clearly about their health needs. Your voice matters when you're talking to medical professionals. We're at day 27. Only 3 more days left. Look how far you've come, from basic greetings to complex medical communication. You've built vocabulary for social interactions, work situations, daily activities, healthcare needs. You're not just learning English, you're building a complete communication foundation for life. Until the next episode, take care of your teeth, practice your dental vocabulary, and remember, you now have the English skills to take charge of your health with confidence. Your English-speaking future is almost here. Bye, everyone. Take care, and see you in the next episode.